lower back exercises for someone who had leg numbness. And it seemed that the reason she was having the numbness in the legs was because of lower back issues, herniated disc, nerve pinching. So these exercises were demonstrated for her in this video. So for the leg tingling and numbness, a lot of the time this can actually be stemming from the lower back, where you have pinched nerves in the lower back that are affecting the legs, because the nerves that supply the legs are going to come off the lower back. I'm just going to give you 3 exercises. You have to loosen up that lower back and hopefully free up the nerves. So this is a good starting point. However, there may be other things that you need to do, for example, nutritional supplementation, possibly medications. But exercise-wise, this is how it is we are going to approach this. So for this first exercise, I'm going to lie flat on the mat. When I lie flat on the mat, obviously there's going to be a gap between my lower back and the mat. It's going to be a small space. I'm going to do exercise to close that space. And in closing that space, I have to flex the spine. So I'm going to lie down. So there's going to be a gap here. Knees are bent. And now I'm going to take the lower back and press it into the mat to effectively close the gap. So this is what I'm going to do. It's just a very short range of motion. So I'm going to press the lower back into the mat. Hold for a second, release. Press the lower back into the mat, release. If you're not sure you're doing it properly, you can take your hand and put it between the lower back and the mat, and think about crushing your hand with the lower back into the mat. So and then I press, so I'm getting that, press, really try to squeeze your hand with your lower back. And if you think you have the movement, you can remove the hand now. Press the lower back into the mat without the hand being there. Try to do this 10 to 15 times throughout the day. For every set, you will do 10 to 15 repetitions. And then as the day goes along, try to do between 3 to 5 sets of this exercise, pressing the lower back into the mat. This second exercise will be the lying trunk twist. So what I want to do, I'm going to put a rotational movement on the lower back. So I'm going to lie down on the bed and anchor yourself properly. Now this is a very narrow bed, so I can actually grip the sides. But if it's your regular bed or if you're on the floor, you can put your hands out like this just to stabilize the upper body. But for my purposes here, I'll just hold the sides of the bed. Just bend the knees like this. Then I'm going to take the knee and bring it towards the floor, keeping the upper back planted on the bed. Don't let the movement pull you off to the side like that. Try to keep the shoulders planted on the bed or on the mat. And now let the knees move towards the floor in a controlled fashion. Bring it back up. Next direction. Now you have to gauge yourself. If you're getting any sort of strange pains or something does not feel right, you will need to stop the exercise. But if you just feel some tension while doing the movement, that is fine. You'll definitely feel some stretch here. So as you get stronger, what you can do, you can extend the legs up like this. Anchor yourself. Control the movement. Okay, so this puts a nice rotational movement on the lower back to free up those muscles, to stretch out those muscles, and hopefully free up any nerves that are being pinched. Again, if it feels strange, painful, if something doesn't feel right, then you need to stop the exercise. Third exercise, what you can do, you can get a light dumbbell or water bottle, put the feet shoulder width apart, look straight ahead, and now lean towards the side with the dumbbell, to stretch the muscles on the side, and able to straighten up. To the side, straighten up. Initially, you can do it without a dumbbell or without any weight. Okay, I'll just do the next side for demonstration purposes. You can do this. Come back straight. Now, if you feel a bit unstable or you feel like you can't maintain the position, you feel a bit wobbly, you can go on, put your hand against the wall like this. Just for some stability. Next side, hand against the wall. If you're rocking, you can brace yourself with the hand. As you feel more and more comfortable, as your range begins to get more and more comfortable to perform, at this point, then you can come back now and add the weight. And now this is a 6-pound weight. However, you can serve in 1 pound, 2 pounds, whatever you have available to you. Again, shoulder width apart so there's stability in the movement. Okay, when you reach straight here, you don't need to come all the way here, no. Let the weight stretch here, straight in position. Aim for 10 to 15 repetitions per set, done multiple times throughout the day. So I hope you enjoyed those videos in which we demonstrated exercises that were given to some of our clients. If you're having knee arthritis, back pain, any spinal issues, you can send your x-rays or MRIs to 747-5297 or 308-3370. We are Progressive Health Services. We are located at number 4 Chincuna Gardens in Chincuna Road, Cunupia.